Hello, my name is Lisa Winter, and I am the Director of Nursing for Caritas Family Solutions. And I wanted to talk to you a little bit today about our Spec program for children, for foster children. Medically fragile or medically spec children are the children that we have that can be a foster child that has special needs. And we're in the process of trying to identify more and more of these children. And this video is to help you understand the entire process, what resources can potentially be available to you, and what does it actually mean if you may have a Spec child. So the first thing that happens is I want to give you a list of potential diagnoses that if you recognize any of these, you can ask your caseworker with Caritas to look through this and even ask some of the nurses, myself or Annette Shaw, whether or not these diagnoses might work for you. So one of the diagnoses is new onset diabetes or even existing diabetes. If your child uses insulin, they could be a Spec child. If your child has epilepsy, if your child has hypothyroidism, any kind of neurological disease, amino acid disorders, cancer, cerebral palsy, drug-exposed newborns, traumatic brain injury, any kind of cleft lip, spinal conditions, and children with multiple medical diagnoses of any types, scoliosis, autoimmune disorders, cystic fibrosis, reactive airway disease, various types of asthma, and any kind of immune compromised situation. What we can do is we can send off what we call a referral form, and your caseworker will help you with that. The referral form goes straight to the DCFS nurse. We will help you fill that out. If the DCFS nurse approves the referral, then the next step is we collect information and documents on your child, primarily history and physical, medical documents, and we also will need a CIPP from your foster care worker. If we get an approved referral, then quarterly, a nurse will come out to visit you and just check on your child. Now, with this comes all kinds of bonuses. With this comes training. With this comes resources that you may not even know that you could get, that the nurse will help you to find these resources, and all kinds of questions that you can ask, including training. So once a foster child comes into our Spec program, then a lot of resources are available to you that you wouldn't have been able to get otherwise. So we're working hard to try to identify more and more of the Spec children that we may have out there that haven't been receiving what they could be receiving, and even some of the foster parents that haven't been receiving what they could be receiving, to help them and support them to take the best care for these children. If you think your child could qualify for the medically fragile foster child program, reach out to your caseworker and we will begin that process, that referral process, or just reach out and ask questions, because it doesn't hurt to ask questions. We can provide extra services to you and supports that you might not have even known that you could have access to. There's a monthly phone call that we have with our Spec nurse to answer questions and provide training. We have helped many foster families get supportive equipment and help them understand doctor's reports. There's just a lot of possibilities. So feel free to reach out to your caseworker or to myself. My email address is lisa.winter@Caritas Family Solutions. Thank you for watching this video.